Good afternoon. Today's topic, we will be covering what skin cancer is, how one can differentiate between healthy skin and cancerous skin, and what to do next if something appears abnormal, and ways to help prevent skin cancer going forward. So first off, we'll start with what is skin cancer. Skin cancer is caused by UV rays from the sun or tanning beds that cause rapid and abnormal growth of skin cells. There are three types of skin cancer that need to be watched out for. The first would be basal skin cancer. This is the most common form of skin cancer and extends into the lowest layer of the epidermis. This is found in areas that are exposed to constant sunlight. It can often appear like a flesh-colored round growth or a pearl-like bump or a pinkish patch on the skin. And this goes to the lowest, like the lower layer of the epidermis. Squamous cell cancer. This is the second most common form of skin cancer, and it's also from constant sun exposure, but this only forms on the surface layer of the epidermis. This looks like red, firm bumps, scaly patches, or even can present as a sore that will heal and can often later reopen. Now, melanoma, this is the most serious and dangerous form of skin cancer and has the tendency to spread throughout the body if left untreated. You can see that it goes deeper into the dermis. This can develop on a pre-existing mole and it can suddenly appear dark as a dark spot on your skin and looks far different from the rest. Early diagnosis and treatment are very important for this kind of cancer, and a tool that you can use to help determine this at home is the ABCDE model. The ABCDE model is the most common tool that can be used at home for self-inspection of your skin. And this stands for asymmetry, border, color, diameter, and evolution. So when looking at your skin, you want to look for any asymmetrical moles. This means that they should appear perfectly round, but if you were to draw a line through the middle, they do not look the same. Next would be B, which stands for border, and you would look for a mole that often has irregular borders. It doesn't look the same all the way around. So one side it could be perfectly circular, and then the next it goes a little bit off. C stands for color, which this would be, it's a different color, maybe darker than the rest of moles you may have. Diameter, you're looking for any mole that may appear to be larger than 6 millimeters. Evolution stands for changes in size, shape, or color over time. So you may at first notice a mole and you may think, wow, that's just a normal mole or it's small, and then a few months or weeks later, you notice that that mole is then bigger, it's changed shape, it may look a little different than it did before. When to see a doctor and what happens next. If you notice the mark on your skin fits any of the criteria for this model, you need to set up a doctor appointment, often with a dermatologist or your regular physician, to have a skin check or a skin exam done. At the doctor may do a complete head-to-toe examination, look at all nooks and crannies all over your body, because they may see something that you may not. It's often hard to see every part of your body. During the exam, they may take photos of your skin for mole mapping for future appointments. If they do see something suspicious or something that they may think is cancerous, they may do a biopsy, where they take a sample of it to send away for further testing, so that way they can diagnose it if it is benign or something that you do need to actually worry about. Often you can help prevent skin cancer in very simple ways. The number one form of prevention is getting yearly physicals along with skin checks from your primary physician, being productive of your health. And doing yearly physical checks increase the chances for catching potential issues early on and allow for early treatment. One of the easiest things that you could do, and you may not even notice a lot of people forget it because they want to be tan in the summer, is wearing sunscreen and reapplying that every 2 hours. Some may need to apply more often than that if you find that you're fair skinned and you burn in the sun. You also want to wear a hat or maybe even a long sleeve shirt. Try to get in the shade as much as you can when you are out. And these are ways that you can very easily prevent getting a sunburn or having an area of your skin that may change over time because of the increased exposure. In conclusion, skin cancer is very preventable when caught early enough and treated. So after today, hopefully you can take what you've learned and apply it to your daily life, whether it is changing how you treat your skin, doing routine skin checks at home, or even going to a doctor on a regular basis. That is often some of the easiest ways that you can prevent things, and hopefully, if you do have something wrong, get an early catch, and the treatment going forward would be a whole lot less invasive than if it is something that you put off and it tends to get way worse down the road.